This was my identity.
Nobody talks about how freaking hard it is to be a dentist. What most people talk about is how this affects the patient. What nobody talks about is how this affects us. Dentistry is ready for this. Now is really the time.
Welcome to Wellness and Dentistry, where today we're going to talk about silent stressors that dental professionals don't talk about. How to fire your entire staff and just use AI. Ha! I gotcha. April Fools. No, we are going to talk about the silent stressors, but please don't fire your staff. I want to introduce my co-host and good friend, Dr. Kyle Stanley, who's a dentist, tech entrepreneur, speaker, and researcher. And my name is Dr. Martin Mendelson. I'm a disabled dentist, coach, speaker, and author. And my first book, One Move Makes All the Difference, is available wherever books are sold. And together, we've helped thousands of dental professionals pursue wellness and dentistry. And if you're unfamiliar with us, we invite you to check out our respective links, websites, and course offerings on our combined website, wellnessanddentistry.com. And if you haven't signed up yet, this month, we're going to be doing our live experience, Lightside Live, on April 10th and 11th in Dallas, Texas. So go check out that information on the website as well. So, Dr. Kyle, how are you, sir?
Hello, I'm doing great. How are you doing?
I'm good. April Fools.
Yes, I like your joke at the beginning. Please, everybody, I love AI, but don't fire your
Yeah,
staff.
don't do that. Don't do that. No, no.
AI is coming and it'll help your staff, but
Yeah,
it's not
yeah,
taking the place of your staff.
yeah. We did have a doctor actually let go an associate in the middle of Lightside Live once. Remember that?
Oh, yes, that's right. I do
Yeah,
remember that.
because I mean they needed to. It was appropriate,
Yes.
needed, and warranted. But because of the experience, they realized they were making stuff up in their head, and they were just like, "No, I got to do this," and they've been very happy ever since. But anyway,
Yes.
non sequitur. So
Yeah, so this topic of the silent stressors, these are the things that dentists don't realize is causing them stress until it
yeah,
gets pointed out many times.
yeah,
Because it's funny how when you talk to dentists, they're always like, "Oh my gosh, I'm so stressed out." And you're like, "Well, what are you stressed about?" And they're like, "Oh, it's like my staff and the patients and they don't want to pay and all this stuff." And then you're like, "Okay, what are you spending your time, money, and effort on?" They're like, "Getting better clinically." You're like,
yeah,
"Wait, what?
yeah,
Something is not right here."
yeah,
And I know a big one that I like to talk about, you like to talk about too, is scheduling.
yeah,
I mean, I don't
yeah.
think people realize how much this can impact their stress in their practice
Oh,
by having
100%.
efficient scheduling, by having a way to schedule or having a goal in mind. I mean, just these simple things can change so much. What are your thoughts?
Well, my first thought is when it comes to scheduling, we've talked about this before, but it's been a long while. I get so sad, and I mean that literally, when I hear people say, "Well, I don't have time to take a lunch." And we've mentioned this before, but not in a while. My really good friend, Dr. Jay Platt, oral surgeon in Northern Indiana, goes to the gym for 90 minutes every day because he knows how to schedule. Or shall I say, yes, he does, of course, but his team understands the expectations and he's communicated that and he set boundaries. Sound familiar? And he goes to the gym 90 minutes every day. So it is possible. And so that's a first thing because, put your oxygen mask on first. You can't keep going and going and going and not expect something to break. That's number one. Number two, it is a limiting belief, to use a coachy coach term. It is a limiting belief that you can't take a lunch or you can't have the kind of schedule you want. It is possible. There are dentists that do it. Now, does it take effort? Yes. Does it take planning, communication? Does it take accountability and the willingness to look at a team member in the face and say, listen, we reviewed how we're going to schedule. We gave you written templates, blah, 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 blah. Today, not one thing was followed. What's changed for you? Like, do you have to have that kind of conversation? 1,000,000%. But it is possible. And I use the word but on purpose. Um, because it's a shame that so many of our colleagues work so hard. So sorry,
I think most
I went
people,
on a ramble there. My
no,
apologies.
that's okay. I think most dentists don't want to have say or give feedback on the schedule. And
Yeah.
so what happens then is you get this Swiss cheese scheduling, as I like to call it, which means
Hmm.
let's just fill the schedule. And a lot of
Yeah.
people think if you have a busy schedule, then you have an efficient schedule. And that is not the case.
No,
You can have
no.
an entire day where everybody's busy, but there's no production, there's no efficiency, case acceptance is low, there's no time for same day treatment, there's no time
Yeah.
for emergencies, there's no time to
Yep.
get new patients in. And those are schedules that kill everybody because you're just busy, 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 but the efficiency is so low. So we
Yeah.
have to have a framework around this. We have to set intention on how to do this.
Yeah. And a lot of times, it's sorry, folks, a lot of times dentists get stuck in what I call the 10%, or teams get stuck in the 10%. What I mean by that is the 10% of the time that things don't work. And so, do we want to create a life based on exception or do we not? And so, what I mean by that is you can have all the templates in the world and somebody calls and cancels because they got the flu. Well, guess what? That's going to happen.
Yeah.
And if you have a team that understands the template, then they will do everything they can to fill it. And if they can't, then they end up putting something else in or not, right? I haven't thought about this in a while. You just made me think of a memory. This is in my honoring my dear friend Dr. Dan Murphy, may he rest in peace. But when I went to his practice, his office manager came in and said, and I quote, "Hey doc, just want to let you know that surgical block on Thursday, Mrs. Jones canceled yesterday. We tried blah 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 number of people. We tried blah 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 blah. So we're just going to make it a build it day." And I said, "What's a build it day?" And it was bringing new patients in or consults in the surgical spot, but they only did that after they attempted to fill it. And it was just,
Mm.
she wasn't asking for permission. She was just communicating. And it was a masterclass, what I experienced in dance practice that day. So,
Yeah. Well, what a lot of people don't even consider too is this constant interruptions.
oh, yes.
So you're doing a crown, but you have to do two exams during that
Yep.
time.
Yep.
That means you have to schedule the crown to be a longer time. And in that too, I think what people do is they say, well, the doctor has to do the exam at the end of the cleaning, right? No, they
No, it
don't.
doesn't.
The doctor should be able to walk in at any point in the, let's
Yeah.
say, hour, put their hand on the shoulder of the hygienist and say, hey, how's it going?
Yeah.
And they sit the patient up and they
Yep.
start having a conversation, right? And because people don't realize just how inefficient we are with our high production stuff
Hmm.
when we're being interrupted all the time.
Oh, 100%. And I also think people get caught in assumption around when things have to happen, like you said with the hygiene exam. What about morning huddles? People get so stuck in the idea that it has to be first thing in the morning. Well, who the hell made up that rule?
That's true.
So if you have people that are staggered coming in, couldn't you do it at the end of the day
Yeah.
for the next day?
Yep.
Couldn't you theoretically do it in the middle of the day? And you're like, well, that's crazy. Well, you're already telling me something right then and there if you're telling me that that's not possible, barring the exception, of course. But there's so many different ways to skin a cat, and we just get so stuck in these, again, limiting beliefs and assumptions around these rules that we have made up that we then abide by like it's gospel. It's unfortunate. It's
Yeah.
unfortunate.
It's like everybody thinks every dental practice has to be the same. And I think that's a big problem. And I
Yeah.
like what you said about setting the expectations and keeping people accountable.
Hmm.
I like to say that you have to tell people what's expected of them,
Hmm.
make it easy for them to do it,
Yeah.
then have regular check-ins to give
Yeah.
them feedback on it,
Yeah.
and then have incentives tied to the check-in and to them doing their
Yeah.
tasks. And
I,
once
I
you,
actually I go through this in detail in my online course in the delegation module, which if you
mm,
just want to listen to that, that's now available. Because how you set up this conversation in the beginning allows you to be able to do that. And if you don't set up the conversation in the beginning to create the psychological safety to then have those conversations, not only can you not have those conversations of check-in variety, but you also can't have the accountability ones done in a way that doesn't feel like you're micromanaging,
Right.
you know?
And that's the thing that I learned from you. I didn't even know about this term psychological safety.
Hmm.
But I like let's say you do quarterly check-ins.
Hmm.
I feel like people should come in knowing exactly what you're going to talk about.
Quarterly, are you talking like an individual team member quarterly
Yes,
check-in? Oh
yes.
yeah, 100%.
It's
I
like the end of the year or the end of this.
oh
They should
yeah.
know, are they getting a raise or not? Based on the expectations that you set. And I think
Yeah.
that that usually doesn't happen. 95%
Mm-mm.
of the time that is not happening. And so then there's stress from the team, there's stress from you
Yeah.
because maybe you're giving them bad news that they thought they were doing great the last quarter.
So one of my mentors once said to me, he said, reviews quarterly or whatever the time frame is should never be a surprise. And if it is, that's a failure in leadership. Because if it's a
Totally agree.
surprise, you haven't communicated properly, right? Period. End of story.
And you should have negative write-ups and
Yeah.
positive write-ups
Yeah.
in that quarter. So
Hmm.
like if they're doing something great, they should get a positive write-up, meaning that they're doing something above and beyond and
Yeah.
you're recognizing them. If they have a
Totally.
negative one, they're late, their attitude is bad, they're rolling their eyes, they're
Yeah.
not cleaning the sterilizer properly, then they should know that too. And then the review is just reviewing that last quarter that they should
Yeah.
already know what's happening.
So because you said it, I can't help myself. Can we also stop telling ourselves that we don't need to say thank you or acknowledge things because it's quote, that's just their job?
So
Like, give
true.
me a break. Like, there's a difference between minimum performance standards and thanking somebody for a good job, you
Yeah.
know? And there's research out there too. You're not just as let me rephrase. There's research out there that the most effective way is being specific.
Mm.
So you're not simply saying, although there's nothing wrong with saying, I'm talking about impact.
Yeah.
Saying thank you for today is one thing, but saying thank you, oh my gosh, the way you handled Mrs. Jones, Mr. Simpson before that really just ticked me off. And you were right there for me. And I so appreciate you being able to deal with that patient interaction because I was just spent and then I was able to deal with the rest of the day. That is a thank you. That's
Yeah,
specific,
that's right.
you know?
And I mean, another thing that we can talk about here are these silent stressors
Yeah.
is staff tension.
Yeah.
And you are the master at this.
Yeah.
What do you
It's
think about
interesting.
this?
Well, first of all, I think I'm going to say something that may be obvious, but we don't like to admit, which is not everybody should be employed in our practice. Period.
Let's just say that one more time.
Not everyone should be employed in our practice.
Yeah, and we need to sometimes have this reality check. I know sometimes it's easier to just keep this person
Yeah.
instead of, you know, being
Especially today or in
being
today's job market.
shorthanded and then trying to find someone else. I know,
Hmm.
but we have to be realistic with ourselves and
Hmm.
be like, maybe this person isn't right for my practice, or maybe
Yeah.
they're not right for this role.
Yeah.
Maybe another role would suit
Yeah.
them better in this
Yeah.
practice.
Yeah. I'll give you a minor yet interesting example. So one of my clients had a younger team member that was given charge of like their social media, like their Instagram or something. And the team member wanted to really do a good job. And this doctor then goes on vacation. The doctor then tells me after the vacation that he was getting inundated with texts from this individual about Facebook posts. And what do you think my first question was?
What
What
kind of
discussions?
expectation did
Yeah,
you set before you
yeah.
left?
What discussions did you have with this person about contacting you while you're on vacation about a Facebook post? And the answer was, as you might imagine, well, nothing. And the individual did admit that they realized that this young woman was trying to do a good job. That's why she was texting him. So that's a positive example,
Hmm.
but it's an example nonetheless of not setting the expectation and then getting upset at the action, shall we say, or inactions of somebody that's under your employ. So,
Well, this comes back to this topic of silent stressors, is that we like to blame anybody else but ourselves so many
yeah,
times.
yeah.
When you look back at it, as the leader, a lot of it really rides on us.
It does ride on us, and also, I mean, I'm horrifically biased, but it comes back to my team framework, frankly. Thoughts drive emotions that create actions that manifest results, and actions can be inaction because inaction is a
Yeah.
decision.
Yeah.
And so we get so, or let me rephrase, we can get so hot under the collar or anxious or upset or disappointed based on assumptive thoughts that may or may not even be true. And so instead of communicating, we ruminate, and it's not good for anybody. And look, I'm just as guilty of all this as anybody else, but I'm also a little older now. So I have a little benefit of age, and it's kind of funny to say that because I never would have thought that, but it's true. And so, you know, you have enough times in life where you assume and then find out it was the exact opposite, and you realize you just wasted 2 hours, 3 hours, 2 days of your life worrying about something. And they're like, shoot, if I had just said something 2 days ago, I wouldn't have lost sleep. And you can only do that so many times before you start to go, maybe there's another way to live. So
Well,
it's a,
it's
it's
Stephen
huge.
Covey too with the circle of influence,
Yep.
thinking about what you can control and what you can't control. So if you say, I can't control, or like, what am I supposed to do about my hygienist that comes 10 minutes late every day?
Yeah.
Okay, can you stop her from being late? No, you can't.
No.
However, what expectations can you set at the beginning? What did
Yep.
her job description say? Well, are you writing her up? Are there quarterly check-ins? How are you communicating with him or
Yep.
her? How have you incentivized them that showing up on time is
hmm
rewarded?
Yeah. And
And that is all part of this personal growth journey. Yesterday, I told you, Martin, but
mm,
yesterday I had a tough day.
that was a doozy.
You only heard the first part of my day. You didn't hear the part of my day.
Oh no, because
I
the
had
part I
I had a
heard was bad enough. Oh my
Yeah, I
God.
had a tough day with a neighbor. I had a tough day with my son, and I had a tough day with my wife. So
Oof.
all three interactions that were challenging, that I have to say I'm not proud of how I reacted.
Okay.
But what I on any all three of them.
Mm.
Um, but what I am proud about is that at the end of the day, I could look back and say, and have the self-awareness to say like, oh, this is what I would have done different.
Yeah.
This is where I think I did well.
Yeah.
This, I think I could have said something different or had a better way of how I said something. And that is a huge step. Like I'm
Yeah.
8 years into this personal growth journey, and I still have these days where I don't perform how I'd like to,
Yeah.
but I have the awareness
hmm
to know why or what or how I would change things.
Yep.
And that's a hidden stressor, is not even having the awareness that you could do something about it, that you did something wrong, that you could have communicated differently.
Yeah. Absolutely. I mean, because think about it. The other option is to sit there ruminating and be mad at yourself, or if you're completely unself-aware, being mad at, in your case, let's say the neighbor or your
Yeah.
family. And that's not doing anything either, right?
Yep.
So being able to have that self-awareness to then get to the point of, okay, what did I learn from this is a really great part of anybody's personal development journey, personal growth journey.
Yeah, and that's where these silent stressors, it's like this sometimes the biggest thing you can do for somebody
hmm
is point out a problem that they don't know is a problem.
Mm, yeah.
And that's
Tell
like
me
what
more
these
about
silent
that.
stressors are. Well, I'm thinking of like, let's say, and you probably got this at Spear too, but let's say someone comes to you and says like, I like my practice is just like not growing. I mean, we're bringing in a ton of new patients. We're busy all the time,
Yeah.
but we just make the same amount of money every year.
Yep.
And you just go like, how's your case acceptance?
Yeah.
And they go, well, we don't track case acceptance. And
Yeah.
then if they do start looking at it, they may go, oh my gosh, our case acceptance is 30%. Like we
Mm,
need to get it up to 60%. Like if we
yeah.
did that, we would literally double the production of our practice with the same amount of patients. It's just like, let's say someone comes over to you at like a mixer and they go, nobody like wants to talk to me. And you tell them, well, that's you have broccoli in your front teeth. You know, you smell bad,
Yeah,
or,
yeah, yeah.
like
Yeah.
your card is ugly or something like
Yeah,
this. Or
yeah.
it's like these unknown unknowns that sometimes you can just point things out to people, and that could be the biggest change for somebody.
Yeah. Or what else I was thinking, because I've talked about this just between ourselves many times about docs that come up to either one of us and they go, I hate dentistry. We're
Mm,
like, well, let me ask you something. Do you hate
yeah.
dentistry or are there things about dentistry you hate?
Hmm.
And usually it's the latter. And
Yeah.
usually within a pretty quick conversation, all the world's problems aren't solved. However, within a quick conversation, the trajectory to figure out what about dentistry is really problematic for them can be done. And that can really change things for people when they start to look at things differently.
Well, that's
You know,
like, in Lightside Live, which we're doing on April 10th and 11th
yep,
in Dallas.
yep.
And we'll go to our show notes and see the links and
Mhm.
sign up and come with us. The second stage, what we do in what's called the ripple effect or our framework is we realize our problems. The second one is identifying those
Mhm.
specific triggers or problems. And so it's exactly what you're saying, which is
Yeah.
just being very specific about
Hmm.
identifying, like for you, like what you said, someone comes and says, I hate dentistry, or, I hate running a practice. And you say,
Yeah.
okay, well, let's talk more about that. What exactly is it? And they may
Hmm.
say, oh, my staff is just always,
Yeah.
or
Yeah.
patients are always whatever. Oh, okay.
Yeah.
Then we can, once we realize we have a problem, we identify the problem, then we can kind of go deeper and learn and
Absolutely.
get tools that we need, spend money on things if we need
Yeah.
to.
Yeah.
And it's just like instead of going at something so general, like something that just came to my head was people saying, I can't lose weight, let's say. And you go,
Mm.
okay, what are we doing here? They're like, well, I'm exercising 5 days a week. I'm doing all of this. I'm tracking this and this. And you go, well, what's your nutrition like?
Yeah,
They're
exactly.
like, oh, well, I just like eat normal food. And it's like, okay, well, we have to really take inventory. It's like I know in your course on what's the part that you do the inventory of your tasks?
Oh, the time and task audit. That's in
Time
lesson
and
two.
task audit. Yeah, it's
Yeah.
funny because I'm doing something similar right now
Hmm.
because I'm going to be bringing on another virtual assistant next month. And so every time I'm doing something that could be delegated, I'm
Yeah.
writing it down.
Yeah. Bingo.
And so
Yeah.
I'm having the awareness
Yeah.
of what's happening. So I'm like
Hmm.
pre-planning to have this awareness to then solve this problem. And that's what you see about these silent stressors is that first people don't know what they are.
Hmm.
If they do know what they are, sometimes they don't want to admit it.
Yeah.
But I mean, a problem understood is a problem half solved. Once we understand the problem, then we can
Yeah.
put the resources that we need or the time or the effort
Yeah.
towards it and start solving some of these.
I'll give you two examples. And, we talked about what we were going to talk about before we hit record, right? But something just really came to me very strongly. In my own business, the things that really stressed me out the most were being consistent in marketing communications like email and social media, and just the financial stuff relative to taxes and balancing books and all that stuff. And I identified those two things. And this year, I now have a virtual assistant. I now have a bookkeeper. Thank you, Kyle. And I have a new CPA. And I didn't realize until we were recording how much less stressed I am
Mm.
because we're recording this in February. And normally in February, I have a constant level of anxiety around taxes, not about paying them, whatever. No, 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 no. Just making sure everything gets done. Look, I've never
Yeah.
been late ever, but it always was a stressor for me. I have zero stressors. It's just gone because I delegated it to somebody else. And I
Hmm.
just, this is a passion plea, folks, because I'm realizing that now, literally live as we're recording, my stress level is so much less than it used to be every single year in Q1. Every year, every year, it's gone, absolutely gone. But it's because I did something about it. I identified it or realized it. Sorry, realized it, then identified what I needed to do, and then did something about it. So it's a huge thing. Wow. I had a therapy session today with you, my friend. So thank you. Yeah.
I'll bill you for it later. Uh, how do you think that the dental professionals listening can help identify these unknown unknowns?
I've been thinking about that. So really, for those of you who are the most in the dark, meaning I just feel stressed, I really don't know what to do. What I would say to you is I would take whatever time you need, meaning a week or upwards of a month, and really look what it is you're doing. If you want to go in and take my course on a time and task audit, fine, but you do what you want relative to that. What I encourage you to do is like with diet and understanding your calorie intake, you need to understand what's actually going on in your life, what you're doing, how much time it's taking to then identify, is that something I love, like, dislike, or hate? And then you can figure out using, for example, the Eisenhower matrix to figure out what are the things that you're going to do immediately, what are the things you're going to schedule, what are the things you're going to delegate, and what are the things you're just going to get rid of completely.
Yeah.
So it goes back to data. Think about it like your treatment planning. You need data to figure out the ultimate treatment, i.e., where you're going to go ultimately. And then you back into how you're going to get there, i.e., got to do ortho and then perio and then restorative, et cetera, et cetera. So think of it like a dental problem in the end.
Yeah. I think we have to be really honest with ourselves because what I've seen is dental professionals that haven't gone through some kind of personal growth journey, they're not honest with themselves on what the actual problem is.
Correct.
And so, I mean, and maybe sometimes this is just they need someone else to tell them what it is.
Or they don't realize the possible benefit they could gain by doing this stuff. So they poo-poo it because it's not as tangible. It's like we talk about all the time where, people want to take clinical CE because they can, it's tangible and
Yeah,
soft skills aren't tangible, but that
right.
doesn't mean they're any less powerful. It's
Hmm.
it's a similar kind of thing where, we're in denial that's not just a river in Egypt, and we're sitting here saying to ourselves, well, I'll get to that eventually. Well, what has to happen for you to be miserable enough? I know Frank Spear used to say something like, "People only change when the pain it gets great enough," right? And I do believe that to a large degree. I really do.
I know. I wish it wasn't the case, but I think
Yeah,
it is the case.
yeah, yeah.
I would love to get people in our Light Side Live course that are just
Mhm.
like, I want to, grow my
Yeah,
grow my business. I want to grow my career. I want to have better work-life balance. I want to be a better communicator. Sometimes it takes their husband or wife signing them up or them being like, I'm miserable and
yeah,
I need a way to get out of it. I need people to
yeah,
understand me. And the same things with some of my other courses and some of yours too, is like sometimes you almost have to trick people into making
yeah,
themselves a priority.
yeah, yeah. Yeah.
And it's like, and I get it because I was just like that. I was the
Yeah.
same way. So I
Yeah.
totally get it. But I wish that wasn't the case.
Well, I guess um, what I'm thinking about is the whole idea around intrinsic motivation. Like
Oh, yeah.
external motivation is a bit of a fallacy. And you have to come to a certain place within your head, if you will, for you to be willing to make that change, right? And nobody can tell you when that is or how that is or why. It's just it's something you have to decide, right?
Yeah.
Um, so
It's okay. So this topic, the silent stressors that dental professionals don't talk about. We
yeah,
talked about scheduling chaos, constant interruptions. That kind of has to do with the scheduling
yeah,
as well. A little bit about decision fatigue,
yeah,
staff tension, these unknown unknowns.
yeah.
Any other final thoughts?
Well, I think just for a second, let's go back to the team stuff for a minute because we didn't really give a lot of detail there, or specifics rather. I think with team tension, a lot of it has to do with really taking the journey, so it's not an instant fix, taking the journey to create a different culture that passive aggressiveness, lack of communication, undermining of others is just not something that we do here.
Hmm.
And that does take time. Oftentimes, it does help to have a third party facilitator, somebody like myself, because when you're hearing it from a third party, oftentimes they'll listen when they wouldn't listen to you. But it's all about kind of reestablishing the rules of the kingdom, so to speak, which is not necessarily a quick fix, but it is something that can be fixed. And like we said earlier, not everybody is a great fit for your practice, and that's got to be okay in the end. So I just want to add a little bit level of detail there.
Yeah. Well, we hope this was helpful for you guys. And again, next week, you could be joining us in
Yeah.
Dallas. This is probably your last week to sign up. So go to the show notes. You'll see something about our website and go to Lightside Live. That is our 2-day transformational CE course. We go over so much of this stuff from leadership to self-improvement, communication, setting expectations, working with staff, growing your business, all by dentists for dentists, and you get CE credits. So we really hope to see you there, and we'll see you on the next episode of Wellness and Dentistry.
Bye bye.